Can I self-treat pelvic floor dysfunction at home? The answer is, of course you can, if you know what you're doing. So let's explore this a little bit, not trying to be a smartass here, but I want to make sure that you understand. Once you understand the principles of movement and how to be, you can do whatever you want, and of course you can. So let's talk about pelvic floor dysfunction. Pelvic floor dysfunction is a name of a book with many chapters. These chapters all are different, and some of them you may experience, some of them you may never experience. Some of them are very obvious, some of them are not that obvious. For example, when it comes to pelvic floor dysfunction, when people think of bladder issues, people think of sexual dysfunction issues, pelvic pain issues, that's pretty much it. What they don't realize is chronic lower back, chronic SI joint pain, chronic hip mobility issues and functionality, poor posture, sucking your tummy in, holding your breath. These are all presentations of pelvic floor dysfunction, as well as all the other stuff. So it doesn't matter if it's the tip of the penis that is having an issue, the base of the penis is having an issue, or if you have pain in the groin or not. All of these, of course, in the absence of more serious red flag issues, I've done videos on that. Then we want to look at what's missing in this picture. By the way, if you have not subscribed to my channel, make sure you do, because I post videos continuously, and make sure you turn on the notification bell so you get notified when I post these things. But back to what I was talking about. Pelvic stability is so critical because your pelvis is a foundation to the structure above. It's so important that you have double reinforcement, muscles on the inside working with the outside to stabilize this, because you are the trunk. Without your arms and legs, you can still function and you can still be alive, but disabled. Without this, you don't exist. So when the outside environment is not stable, the inside has to make up for that lack. And when the inside makes up for it, it's overworked, it gets tighter, sometimes it gets weaker, because tightness over a course of time is exhausting. So it shows up as weakness. Weakness and tightness indicate imbalance. So there are structures, there are residents inside the pelvis that when this environment becomes smaller as a result of tightness and instability, then those residents can speak up. What resides here are muscles, ligaments, joints, nerves, arteries, veins, bladder, intestine, prostate, uterus, and ovaries, depending on if you have a penis or you have a vagina. That's the only part that's different. So that means all of these can speak up, or some of these may speak up, or they may speak up at this point, and then later on something else shows up, and then something else, another resident speaks up. So when I'm sitting down and I'm listening to the patient, I can see a clear history of what this poor body has gone through. Then the task changes to, okay, let's stabilize the pelvis so we can bring back the peace and harmony. It starts with biological breathing. That's the first step in the right direction. If you don't know how that's done, we'll make sure we put it at the end of this video, but make sure again to subscribe to the channel, because if you had, you would have known this. Biological breathing is how we breathe as babies, and that's the reason why babies look chubby. They're not chubby. They're using their breathing apparatus correctly for stability. That has to be in place in order for all the attempts we all made, every single one of us, that got us as a helpless infant to become running toddlers. It took a lot of effort to become a running toddler, that every single one of us have done. So we can do it again, and that is the method to stabilize. Once you understand how that's done, then of course you can do this at home, because you learned how to. This is like learning how to drive a car. That means once you learn how to drive a car, you can go to any destination you want at any time that you want. Nothing has changed. Everything's the same. I hope this made sense. I hope you realize that you hold the solution to your movement problems and pelvic instability. What's holding you back? I don't know. If you need help, make sure you use one of the methods of contact in the description box to contact me. And do know your body was created to serve you until the last breath, and your body parts will not work against you. Give them the environment they need, and you'll be amazed at what they will do for you. Thanks for watching.